Hi, everyone. Very much welcome to our session. I'm having just a little bit of trouble with my screen. Welcome to this event, Reimagining Global Health Ecosystems. We're co-hosted today by the Millennium Lives Collective and a very important MLC member, Equalize Health. My name is Megan Majorowski. I'm a senior advisor for the Center for Innovation and Impact at USAID. At the Center for Innovation and Impact, we apply the business-minded approaches to the development, introduction, and scale-up of health interventions to accelerate impact against the world's most important health challenges. As a reminder, I will be sharing many opinions today, which are mine alone, and I don't speak for USAID, but we really feel that the ecosystem question is quite important from USAID's work. Our center is spending a lot of time thinking about how to get innovations better selected, introduced, and increase uptake of the most appropriate approaches, programs, and innovations to local global health challenges, and really investigating how we can be more country-led, thinking about country demand, thinking about that from a user perspective, from an intermediary like healthcare workers, as well as from the range of local procurers. Now, making sure that we have the most appropriate innovations is really only part of the challenge. Thinking about how to ensure that there is truly a well-enabled local ecosystem that will foster local innovation over the long term, making sure that local innovators who tend to know challenges best are well linked up to other innovators who might be able to contribute different skill sets. How do we make sure that funding that links to other international organizations, many of whom are here today, are really part of that ecosystem? So as we think about the development pathways of innovators and innovations, we know that global health has many diverse actors and experts, perhaps more than any other field out there in development. And as we respond to and recover from the pandemic, we have seen the need for collaboration to develop and deliver solutions at scale, more than ever, making this conversation really timely. Today, our panelists will discuss the challenges and opportunities of collaborating with different actors while dealing with the consequences and opportunities of this pandemic. Before I introduce our speakers for today, I'd like to draw your attention to our opening question, which we would like for our audience to submit using the chat function. Make sure to send your responses in the chat to both the panelists and the audiences. How do you define global health ecosystem today, and what do you think is missing? So we'll take a look at your responses alongside when we hear from the visions and perspectives of our panelists. But please let me take a moment to welcome our speakers. First up, we have KK Krishna Kumar Sankaranarayan from Equalize Health. He is the India Managing Director. Tunji Aleso, who is the Investment Manager from Grand Challenges Canada. Monica Kainer, Senior Manager of Global Health Programs, and Hannington Segarinya, East African Representative, both from Assist International. Bios will be in the chat. Want to see if anyone, I haven't seen any ideas from our audience yet, so I will go ahead and just address a few housekeeping items. We are recording this event and it will be made available on the Million Lives Collective YouTube channel, and please do use the Q&A functions throughout the discussion. So let's take a look at how our audience defines the global health ecosystem today and what's missing. Folks are raising that, thinking about that international standards aren't that the European and ISO, which often overlook the requirements in some of the settings in which we are hoping to work. And waiting to hear from our other audience members. Why don't I then hand over to our first panelist and see just ask the question, as we begin to reimagine global health ecosystems as a system that not only has to support scale, but also accelerate it, let's start with considering who needs to be part of this conversation, and especially who has been left out in the past. And I'm wondering if KK might be able to give us a perspective on this while we hear from more from the audience.
Thanks, Megan. Good morning, everybody. It's a pleasure to be part of this webinar, along with distinguished panelists from Grand Challenges, Million Lives Collective, and Assist International. So I think if we were to look at the two most important stakeholders in a healthcare ecosystem are the healthcare providers and the patients. So if you look at the past 18 months or so, the healthcare workers have put in longer hours, have treated more patients, and unfortunately seen far more deaths than they were to see. Right? So this has taken a significant impact on their well-being, both physical and mental. Therefore, the need to address the expectations and the requirements of the healthcare providers, I think, is significant. And this is not just a developing country problem. I think it's true for much of developed countries as well. I think we also are seeing in several parts of the world that apart from the emotional stress that pandemic is causing, there are also cases where healthcare workers are being physically assaulted by patients and their families and so on. So there is a physical risk element which needs to be addressed. We also see that healthcare workers, especially the frontline healthcare workers, community workers, for example, are not being paid on time. So the work stress is being compounded by a financial stress, as more resources are being diverted towards management of patients and procurement of supplies and PPEs and so on and so forth. So I think that's putting an enormous amount of strain on the healthcare workers. I think what we are doing as Equalize Health through our user-centered programs and a team called YouTube is essentially trying to function as a high fidelity microphone, megaphone of sorts, so that we are able to amplify the voices of the frontline health workers in such a way that it's heard clearly in the corridors of power. I think that's and the decision makers. So I think that's an important stakeholder. I think the other important stakeholder is the patient. And unfortunately, in many parts of the world, the patients are not an organized body. They often are individuals and families, and they lack collective power unless they come together in some form of an organization or cooperative. Many parts of the world, the only way they can demonstrate their feedback is through their elected representatives. So I think the voice of the patients, therefore, is very important. And that's something which has not been heard enough. And just like any other episode of healthcare stress, it's the women and children whose voices have not been heard significantly. And I think that's a cause for concern. Also, what COVID has done is to take away a lot of resources that the healthcare systems possess away from non-COVID areas, whether it's communicable diseases like tuberculosis or non-communicable diseases like cancers or heart disease and so on. I think many of these patients have just not been able to receive the care that they deserve just because the healthcare systems have been doing. So as we look to a new healthcare system in the post-pandemic world, I think we need to keep the perspectives and the shortcomings of not just the well-established parts of the healthcare ecosystem, but also the most important stakeholders, which is the patients and the patients.
Thanks so much. I think those are really, really important perspectives and definitely stakeholders who we have not been doing as strong of a job incorporating to date. Another question to our panelists. We've been talking about who needs to be part of the conversation. So how, therefore, can we better connect and collaborate with the various stakeholders in global health, from research and industry to implementation? We had a great, in terms of the definition of our ecosystem, I think kind of a question that falls in there. A lot of the different parts of the value chain, from kind of innovative idea all the way through to scaling up of the innovation. Many of those items happen in isolation rather than in a much more coordinated fashion. So both the different actors and across that whole value chain, how can we think about better collaboration and coordination? Gonna hand over to Hannington.
Thank you very much, Megan, and I'm so happy to be part of this and share our side of the story. On this issue, we have realized that it's very important getting input from people who are hands-on right from the beginning. I'll give an example, like biomedical technicians in hospitals or biomedical engineers. When you go to a hospital and you have a program around biomedical engineering and it's really, really key to engage higher, and we talk to the administrators and staff without engaging them. And normally it creates a huge gap. It's a huge gap between the administrators and the real people that make the hospital run. The biomedical engineers are really that engine that runs a hospital. For example, there are so many cool, innovative also ideas that have been brought forward. There are so many innovations that have been designed for LMIC settings. But the question we normally get after the designing is, how do we get these innovations into the market? And in such cases, most of the time we focus on clinicians. Yet normally, it's very important to know that they are not the ones who make the decisions about what will be purchased for a healthy center. So there is need to make sure that the purchasing department, the ministries of health, and the hospital administrators are put in touch. They are well connected so that we get their buy-in. It will be very easy that way, because sometimes there is a gap in the clinicians and the purchasing teams. And many of our telementoring hub directors advised us connecting to ministries of health and other government organizations for endorsements and also buying of new innovations. We followed suit in the different countries where we work, and this really worked. We saw a great difference having these people on board because they really understand right from the beginning, because we introduce them to everything. And then the other part of it is publishing research. In most cases, research is published in a big medical or health journals, and that's where it ends. But there is need for us to bring it down. Local newspapers. Newspapers, they have a healthy pay.
We seem to be losing you a little bit. Would you mind turning maybe off your video for a second and see if we can hear you? Well, since we seem to have lost Hannington, I'm gonna gonna loop in a question from our audience who were looking for more examples on either great collaborations or some real lessons learned. And I wonder if you have some additional examples, and then we can loop back to Hannington and see if we can hear him again. KK?
Yeah, I can give a couple of examples. I think, for example, one of the things that we've seen in the Indian healthcare ecosystem today has been great collaboration between technology companies and healthcare organizations, right, for delivery of telemedicine or care through electronic means. I think one of the concepts which kind of became very popular during the pandemic was this concept of tele-ICUs. That was facilitated by a partnership between obviously the healthcare providers, healthcare frontline health workers, medical technology companies, and information technology companies. And what it helped was in many parts of the country where access to intensivists and critical care specialists has been poor, it did allow a lot of these health facilities to be able to access expertise which might not have been available to them otherwise. I would argue that it helped save a lot of lives during the pandemic. I think that would be an example of an innovative approach that hospitals took, and something which has been successful. And it could become a template for the future as well. Another example which we've seen is greater collaboration between government research labs in India and commercial organizations in terms of transfer of technology. For example, a lot of the government labs developed testing kits for COVID-19, which were then commercialized by medical devices or medical technology organizations. So that again was a process which was there, but it had not gathered critical mass or momentum. But I think COVID provided perhaps a trigger for greater collaboration between researchers and industry, like was just mentioned by the previous speaker.
And I just want to pause for a moment, Hannington. I think we lost some of your comments at the end. I wanted to see if we could hear you again.
Can you hear me now?
We can.
Yeah, good. On this side of the world, we have a lot of internet issues, so you will bear with me. Yeah, I was talking about the issue of publishing research in areas where implementers are looking could be a great step too. But there is also need to publish in less academic streams. In most cases, these publications are in those big publications, and a healthcare worker in my village in Uganda would not have access to this. Maybe they work in a deep area, internet connectivity is so bad and all that. The only time they have to use internet is when they come to the towns. So there is need to publish in the local newspapers and have an article there. And normally these local newspapers have a healthy page. And then once they see that, it will trigger them to do more research when they visit a big town where there is good internet connectivity. So there is need for that. So that was my last point on that. Thank you.
Oh, and it's a hugely important one, and I will actually open this up to the other panelists as well. I wanted to just explore a little bit if anyone has examples. I think we all aspire to bring diverse stakeholders into the conversation, and I'll just admit, certainly there have been a number of times when things that I've done myself, we realize midstream that we have forgotten really important collaborators along the way. I wonder if anybody has any examples of times when you were able to bring in important collaborators. Sometimes I think there's this pressure that if you didn't design it that way from the beginning, it's hard to add people in later. Does anybody have any examples they could share of times when you had to do some course correction and how you went about that? KK?
Yeah, I think typically what we've seen is one of the things, for example, when the government decided to launch its major vaccination program, right? I think there was a lot of emphasis on developing the supply chain, right? And for the major part of 2020, most of the discussions in India about vaccination was centered around the availability of supply chains and how inadequate it was, especially cold storage and so on and so forth. To the extent that we kind of almost forgot that the major challenge was likely to be availability of vaccines and availability of vaccinators. Right? And surprising as it may sound, that India produces 60% of the world's vaccines, but it took us quite a while for us to ensure that the supply of vaccines was kind of adequate for the needs of the population, and so on and so forth. And of course, that the vaccinators were adequately trained and prepared for using the new electronic system that the government had introduced, and so on. So I think it kind of, looking back at it, it appears so intuitive, but it was one of those things which is, as the saying goes, hidden in plain sight. I think this was a classic example of quite a big thing being hidden in plain sight, and therefore a need to have more of a systems approach, look at all possible stakeholders and ensure that they are aligned before a mega program is launched. And that's one example which kind of comes to my mind.
Mm-hmm. Speaking of examples of real lessons learned, I wonder if I could ask our panelists how we can leverage lessons learned and challenges highlighted from the COVID pandemic to amplify change. Have we created opportunities for collaboration due to the lockdown and everything, where our stakeholders are being asked to really perform in such challenging conditions over the last year or two in responding to the pandemic, that we can apply going forward? I'm wondering if I can hand this to my colleague, Monica.
Yeah, sure. Thanks, Megan. And thanks everyone for inviting us to be here today. Assist has definitely learned a lot, I'm sure, as others have over the past 18 months now. I think one of the biggest lessons learned so far has been reducing reliance on international partners such as ourselves. Similar to Equalized Health, KK, you mentioned leveraging existing telementoring training programs. And so we provided COVID-19 relevant training programs in partnership with academic partners such as Stanford Global Anesthesia. However, Megan, going back to your previous point, we recognize this was still very global north focused. And so we pivoted and course corrected to equip 10 course directors across Africa and Latin America with the resources to lead their own oxygen therapy and critical care telementoring hubs to ensure a reduction, to reduce reliance on us, on any other international partners, so they could continue programming in the wake of travel restrictions, but also to make sure that everything was tailored to the local context, to the local languages, to time zones, to things we don't always think about. And so that was very important, and we continue to expand on that work today. Another lesson learned or challenge we're trying to overcome is broader scope of in-country team members and leadership roles and local ownership of projects. So having in-country team members is very common across the NGO development space, but often decisions are still being made at headquarters in Europe and North America, for example. And so at Assist, we recognized, and it's a discussion I think a lot of us have had pre-COVID, but really was put into, amplified during that, we needed a broader scope of team members globally in leadership roles to not only implement programs, but be able to, they could make real decisions and real-time decisions on them for time-sensitive issues. So for example, we're working with these telementoring hub directors now to create a center of excellence for emergency medicine and critical care based in Africa in order to ensure full responsibility and control rests with the teams there. As KK, as you mentioned, to amplify their needs and voices, as opposed to us trying to figure out what that might look like for them. Of course, it should be for them, by them. And then the last lesson learned I would mention is working with existing resources. So not everything has to be shiny and new to have great impact. For example, at the start of the COVID wave in Africa, our Assist previously trained biomedical engineer technicians in Ethiopia assessed medical equipment, sourced repair parts, and repaired non-functioning equipment. And we're able to increase the number of functional medical equipment there by about 23-25%. So by working with existing resources, the team didn't have to rely on a backed up supply chain to access working equipment. And then one other quick example I'll give is our existing oxygen, our medical oxygen program made it possible during COVID for rural communities to access oxygen even when supply chains were restricted and the need for medical oxygen skyrocketed. We had trained maintenance, and again, biomedical engineer technician teams, BMETs, are really the underdogs of the global health space, I have to say. They assessed and maximized oxygen production at various facilities that we work in, and they were able to increase available oxygen there to surrounding communities. So again, they worked with what they had in their training and were able to really derive great impact from this.
Mm-hmm. Definitely think that the oxygen ecosystem and hopefully the lasting enablement that it will offer kind of across global health, especially in kids, will pay off. One of the glimmers of upsides from the from COVID. I want to hand off to Tunji on the same question.
Sure. Thank you very much, Megan. Yes, I mean, in line with Monica's examples, as a funder, I directly manage the oxygen portfolio at Grand Challenges Canada. And so the example I will be giving is in that direction. But I think what COVID has done is in some ways forced demand and supply sides to come together in ways that perhaps before COVID, well, a bit hesitant and trying to figure out how best to get it to happen. So I'll give an example. With the advent of COVID and trying to get oxygen solutions on the ground, a lot of the decisions we had made in the previous kind of 2-3 years around enabling local teams, having leadership teams and organizations on the ground driving and providing solutions, and we just being an enabler. We found a scenario where, working with WHO, HQ, WHO regional office in Africa, and the WHO office in Somalia, we were able to, with support of other funders like Open Society and the Women and Children's Health Research Institute, to enable a solution, a solar-powered oxygen solution, driven by a local team, Global Health Uganda, led by Dr. Michael Hawkes, to then get that solution into Somalia. They already had implementation in Uganda and in DRC, but using WHO kind of coordinating the demand side and GCC working with other funders looking at the supply side and innovations that are already in play on the ground, we're able to, in a 4-week time frame, get that solution to Somalia. Now, it made things move a lot faster than typically would have. And that's the kind of collaboration we'd like to see going forward, where demand and supply sides can really figure out how to get the solutions to the end user. Because at the end of the day, as KK has mentioned, healthcare workers and the end users, perhaps haven't had that kind of voice. But looking at that kind of example and how we're very quickly with leadership on both sides to get that solution to Dusamareb in Somalia in a 4-week time frame was really transformative. And it was, straight away, once it was done at the hospital, immediately started, being implemented and saving lives on the ground. Now, that for us was a really clear example of how these collaborations are critical and how decisions around enabling local infrastructure and enabling local companies is going to be critical to making the ecosystem function a lot better for global health as a whole. Thank you.
So we've had two perspectives, from headquarters per se, of what were some lessons learned from COVID. I wonder if I can ask KK and Hannington if they have any perspectives on some lessons learned and things that they think can be helpful moving forward.
Thank you very much. Thank you very much, Megan. I hope you can hear me. Yeah, one thing that we have learned is empowerment and collaboration. These are really key. And the best time to do this is like yesterday. So one thing that we have learned is there is need for us to continue in this space. Let us create more opportunities for empowerment and collaboration and partnerships. And together we'll realize that we do not have the same talents, but once we bring together all these talents, it will be very, very helpful to build something bigger. And from that, it will better prepare us.
We may have lost KK, so I'm going to see, sorry, Hannington. So I want to hand over to see if KK has any additional thoughts.
Yeah, thanks, Megan. I think the other thing which probably has come through in the pandemic is the importance of data, right? Very, very basic data about, for example, the number of beds in a geography, right? How many of those beds have facility for oxygen, how many of them are intensive care beds, and what's the number of healthcare workers that is available. So very basic data sometimes lies in different silos, and becomes very difficult for decision making. The other point, which going back to what Tunji was talking about, demand and supply was very critical. Like one of the things which happened in India was that when COVID came, a lot of governments decided to open up the so-called jumbo centers, incorporating huge number of beds in one facility. And a certain percentage of those beds were also oxygen beds. But what they failed to keep in mind was that with each oxygen bed, you need to have oxygen supply, right? And suddenly we found that there were a lot of beds which had facility to connect to oxygen, but the supply of oxygen was not kind of keeping pace. And then we saw some very disturbing images of patients and families running around trying to locate oxygen cylinders and so on and so forth. So I think therefore the balance between demand and supply of every commodity, even something which we take for almost for granted as oxygen, I think is very critical. I think that's the other lesson, I would say, from the pandemic that one needs to keep in mind. Yeah. And we've all known that, a chain is only as strong as its weakest link, and anywhere where the link is likely to get broken, the chain is going to, give way. So just need to be careful of.
Yeah, I definitely think that thinking through the weakest link leads quite nicely to one of the next questions we wanted to pose to our panel. In global health today, we obviously are focusing in on the pandemic, but health inequities existed prior to the pandemic, and some valuable, albeit slow, progress has been made toward the SDGs. So how do we decide when to re-engage, and how do we accelerate progress to the SDGs while doing that in a pandemic world? I think for many of us, we would have liked to have just pushed the pause button, and when all this is over, we'll go back to our day jobs. And it's very clear that's not going to happen. So wanted to hand over to KK to get an initial perspective on that, but I'll want to hear from several of our panelists because I think it's a really important question.
Thanks, Megan. I think one of the things, and this is something which Mr. Bill Gates has mentioned in his recent Goalkeepers report as well, that what the pandemic has taught us is that progress is possible, but it's not inevitable. And therefore, the gains that we've made in progress towards SDGs has been positive over the last 30 years. And if you look at the trend lines, they've been obviously positive. But I think as we look at the health systems today, I think there's been a significant pause in the trajectory of the progress towards SDGs, and for a variety of reasons. I think health systems, financing, supplies, everything which kind of an impact on routine work, immunization, and so on and so forth. I think every aspect of our progress towards SDGs has taken a pause, and therefore it's important to start re-engaging kind of now, I would say, because depending on, none of us knows when this pandemic is going to end. And therefore, to think that we can restart after, the pandemic phase is over, possibly might be late and the end is not in sight, fortunately. So I think it's important to start thinking about it now and start acting upon it now. I think the way forward, like other panelists have mentioned, I think it's a combination of three factors in my opinion. I think one is empathy, right? I think it's empathy for everyone who's been impacted, and especially the patients, their families, the health workers who have been, and of course, a lot of professions, are centered around the hospital, right? And when the hospital health system is not working, a lot of the support ecosystem also tends to get impacted. So that's obviously one. The other aspect is innovation. And I think if the pandemic has revealed any positive outcomes, I think it's the impact that innovation can create, and no greater example of it than the vaccines which were available within 12 months of the pandemic being declared so by WHO. So I think the importance of innovation has been emphasized repeatedly. And of course, the third aspect of collaboration, because the problem is so big that I think it requires all of us to come together to address that. So I think those would be some of the key takeaways from current pandemic so far as strengthening our progress towards SDGs.
I want to open that question up to the rest of the panel. Please feel free to jump in. Monica has her hand up, just thinking about when and how to re-engage on some of the SDG activities we were doing prior, and how best to do that in a world where we will be dealing with COVID for some time. Monica?
Yeah, thanks. As you know, as an implementing organization, ASSIST is often guided by our funders, and priorities over the past 18 months, rightly so, have been on COVID and COVID response. And that's been, of course, critical to everyone. And in certain aspects, it has bolstered our core programming. So for example, access to medical oxygen has been and still continues to be such a primary need in COVID. And so that's something that we continue to work on. But other programs, such as, for example, our safe surgery programming has, I wouldn't say fallen to the wayside, but has been, paused or reduced because of other priorities, and not just with funders, but of course, hospital surges in areas, hospital capacity, things like that. And so it would be nice to see a shift back to our older pre-COVID programming to some extent, so that we can continue on and make sure that we are trying to meet our targets for the SDGs. And unfortunately, things happen. We, beyond just COVID, we have a program that continues, or we try to continue it in Myanmar with COVID and the political situation going on there. And of course, other organizations have programs going on in countries with similar situations. And so we have to keep trying to move forward with our goals, regardless of health, political, et cetera, situations, if we can, because otherwise we are going to fall behind, unfortunately.
Mm-hmm. Tunji, I wonder if I might be able to ask you to chime in from a kind of a funder perspective.
Sure. Thank you very much, Megan. Yes, at the onset of COVID, what we saw was most funders kind of, doubled down and looked inwards to those already in their systems who could, kind of tweak systems to get support out as far as COVID is concerned. But, we've also seen a scenario where, lots of funders now are beginning to look at, how do we continue the work we're doing around the SDGs, because they're not going to go away anytime soon. And if we don't address those, then we're going to continue to struggle, post-pandemic, especially now that it's very clear that COVID, appears it's going to be here for some time more. So, for example, at GCC, we launched a call for for proposals around sexual health and sexual and reproductive health and rights. Again, recognizing a very neglected area of healthcare and ensuring that we continue to engage both with academia, with research, with innovators to ensure that, you know, we are moving the needle and we are continuing to support, you know, exciting, brilliant, bold ideas with big impact in those areas. So I think, you know, initially we saw that kind of everyone tunneling down, but, you know, gradually once it became clear that, you know, this is, you know, perhaps a long game, a lot of funders then kind of refocused and, you know, started going back to what they were doing. Maybe not at the level pre-COVID, but we're seeing organizations such as ourselves really ramping, and that's because our systems are very much multifaceted. It's not, you know, just one thing. I manage Oxygen, but I've got lots of really fantastic colleagues managing other parts of the healthcare system. So we've seen a lot of effort and emphasis going into those areas to ensure that, you know, we keep the move and the momentum towards addressing SDGs. Thank you.
I'm going to throw out there a follow-on question. You know, if anybody can share any specific examples of innovations that have come out during the pandemic that appear to be having, or at least having, or have the option of providing benefit to the SDGs. So for instance, one thing that comes to mind is the multi-month dispensing. It's, you know, big across many of our health areas, obviously quite a important element in our Office of HIV/AIDS care, providing patients many months. It's long been a PEPFAR goal to shift from patients having to come in every month to get their meds to being able to get 3, if not 6 months. And certainly COVID has hastened the need to really push for multi-month dispensing and push for community-based and a whole range of other real innovative approaches that might have taken a lot longer to implement were it not for COVID. But we do need to step back and follow up and make sure, you know, what's working for patients. Obviously, this is a relief button for supply chains, for the capacity of already squeezed healthcare workers and facilities. But how is this working for patients? It would be great if it was a win-win, but we do have to ask those questions. I wonder if anybody from the panelists to our audience might be able to kind of bring up another specific example of some COVID innovations that we think are going to be transformative to some of the other areas of the SDGs.
Yeah, I think one of the examples which I mentioned briefly earlier on was this entire concept of connected care, right? For many years, India has been, and many parts of the developing world have been experimenting with care being delivered electronically, right, remotely, and it has been attempted in, you know, a lot of pilots have been done, but none of them has really reached the stage where it's been scaled up and adopted, primarily because I think the need to change probably was not as significant as it was during the pandemic. And I think that is a trend which I believe is likely to stay, at least some parts of it, where it is where the inequities in terms of access to care are the highest. I think technology can provide a solution, and I think the simplicity of the technology has played a significant role in making it convenient for frontline workers and even specialists to kind of adopt some of these connected care solutions. And of course, alongside this product innovation, I think what we've also seen is there's a lot of business model innovation, which some of the service providers have brought in, right, which has facilitated adoption of some of these connected care solutions to different parts of the healthcare ecosystem, especially those parts where, for example, intensivists, even large cities in India don't have enough intensivists, and therefore it almost serves like a like a multiplier effect in terms of the number of beds that they could, manage sitting in one place, and so on and so forth. So I think some of this, amongst the different things that we've seen, perhaps connected care is one innovation that's got accelerated, I think is here to stay.
Mhm. And I saw a comment from our audience, and I'll throw one additional element out there. Our audience member mentioned kind of self-testing as an interesting example of things that we've seen that are transformative. And I wonder if I can layer a additional element to that in terms of better incorporation of the patient and the private sector into kind of the whole value chain. And there's often talk about that, but sometimes it ends with talk. In some of our other SDG areas, have folks seen examples around that? Would be a question. A second question for the panelists would be, what is one concrete step that that we can do to accelerate newer and reimagined solutions like what we're talking about to become the norm rather than the exception?
Sure. Thanks, Megan. I think I've got a couple of examples. There's this innovation based in South Africa called Aviro Health, and what they've done simply is build this really interesting system around self-testing. Initially starting with HIV, but now looking beyond that. And what we noticed was, with the advent of COVID and people staying away from the hospitals, it really helped to ramp up the need from a patient perspective, where, through WhatsApp, they can get, kits sent to them, they can test, they can go onto a platform and put their results there and gradually start linking to care. Again, yes, lots of kind of experiments going on in different places, but I think what COVID has done is really amplify and bring in a lot more use cases, very relevant use cases for these innovations that can then hopefully potentially get them to a point where they can scale. And, as we say, that hockey stick growth, because it is really serving a need, and the audience and the users are there because of the challenges of visiting healthcare centers and things of that sort. Initially, they started as a solution that can be used in a health facility, right, through personal booths and things of that sort. But with COVID, very quickly, pivoted and are able to support even, governments in, the Western Cape and in Kenya to get those kits out to users and get them, getting in, the outcomes, and then linking to care, which is a really critical aspect. It's not just enough to know where you stand or what your status is, but then link it to getting the ARVs in a timely manner to your doorstep. Now, a second example, in India, Karma Health, based out of Rajasthan and Haryana, which are not the very affluent Delhi areas, where through a network of e-doctor clinics is able to get users to do basic triaging, connect with the doctor, get diagnosis done, and importantly, get medicines to the users at their doorstep. Again, really, usually small pilots that, you always struggle, how would this scale? But with COVID and people not being able to, visit, health centers, we saw a really interesting uptick in people wanting to use this, system. And of course, the innovators being very flexible to tweak their systems, build WhatsApp, integrations, and get people, really texting and being able to connect in very low resource, low bandwidth areas. And so lots of experiments are going on, but I think what COVID has done is giving some of these the avenue to really ramp up. And then the hope and the goal now is that lots of kind of health financing can uptake some of these innovations and get them to scale, because there's demonstrable evidence of the use case and serving patient needs, which again, as Keke has mentioned, one of the mostly neglected areas of the ecosystem. Mm-hmm. So really exciting times, and hopefully, more opportunities to scale them up.
Yep. And I think from a USAID perspective, and again, reminding everybody I speak for myself, not for USAID, what I wish we could do, I think we immediately concretely can do is better illustrate through case studies, promotion, not just in publications behind paywalls, but how can we do a better job of making clear those unique examples that feel like a COVID experiment, and make it clear that those could be scalable for other opportunities. And my wish list would certainly be to provide some funding so that kind of local partners, our local missions, would both have the bandwidth and the funds to experiment bringing those COVID adaptations to be applied longer term to some of our SDG programming. So, that would be my wish list, but in the near term, without funding, certainly doing a better job of documenting, sharing, and really promoting what are promising practices so that they can actually become best practices. Wonder if any of my other panelists have additional kind of concrete examples of ways that, that we can think about bringing these COVID hacks into much more regular practice.
I think what these COVID hacks have shown us is that once there's a will, there's a way. And once there's an incentive, then it rallies everyone together, and you then find ways to tweak your own internal systems to ensure that you're not lagging behind what the need is. And I think what we then need to do is find ways to bring that urgency to other areas, which will require, tweaking internal systems. I saw a comment around, the slow pace of how funding goes out. This, in my opinion, with COVID, will force a lot of funders to kind of rejig how their processes work, so that way, we don't find ourselves with further crises in other, areas around the SDG, which to a large extent, in some context, hasn't had the kind of emphasis that COVID has had. So I think, primarily, it will make systems within funding, networks and ecosystems really get tweaked. Because at the end of the day, what we are there to do is fund really exciting, things. If the process takes too long, then, as we've seen with COVID, it then makes it a moot point. So for me, I think that's the biggest lesson that we're going to see from this. How do we take that urgency into other areas, and how do we tweak our systems to ensure that money can get out as quickly as possible to local ecosystems and to local players, because they know the problem and they can solve the problem locally. Thank you.
Great, and I'll hand off to Monica for maybe about a 1 minute response, and then we'll wrap up.
Yeah, thank you. Just to build on to what Tunji said, and the question that came in about funding, the pace at which funding goes out, we've seen it get quicker in COVID, and that's great, and I hope that continues, but also flexibility in funding, because and I see Tunji waving, agreeing, and then we work together very closely. So we've had great experience with Grand Challenges Canada in this, but just the opportunity to pivot when needed in programming. Everyone experienced that in COVID. Funders have been very flexible with that in terms of being able to continue programming and or pivot very quickly in new ways to address COVID response. And so hopefully that will continue going forward, because there are always things that need to change. And if we have to go back through, big bureaucratic institutions to take months to get responses to that, then sometimes it can hinder quick programmatic change and movement. So hopefully that will also continue into the future.
Absolutely. Thanks. Great points all. We're a little tight on time, so I do want to take a moment and just reflect back a few things that we've heard, and then ask 1 or 2 last questions of our panelists before saying goodbye. So we've really thought about several core questions. First of all, who really needs to be part of creating the new ecosystem? Really heard a need to focus in on patients and healthcare workers, but we've talked about kind of more novel areas of the ecosystem, other financiers, the private sector, but I think the overarching message was doing a better job of ensuring that it is locally led, locally sourced, and locally driven. We talked about facilitating better connections and collaboration. So certainly using many of the lessons learned from the COVID pandemic about how technology really can aid in that, but not just making it a technical solution and inclusive solution, but how we transform it so that decisions can be made locally. It's not just having people having seats at the table, but how do we empower and enable the decisions to be made by the people it is most, things that are being most affected. Also talked about how can we have our response to the pandemic be a catalyst for this change, and just imploring that some of the solutions that we've come up with, both for inclusivity and finding ways to do absolutely amazing responses with less. How do we keep that? How do we keep that going in a much more sustainable way for our local healthcare workers? But how do we also incorporate that into our programming, and especially how we think about funding, moving funding faster? Ideally, of course, it would be great if we had more funding, but how can we really take those lessons learned in terms of inclusion, technology, enablement, and make those more permanent? So I want to end with one last question for Hennington and Tunji. From your perspective, what is the single most significant problem that the pandemic has amplified? And how does your vision for global health, for the global health ecosystem, really address this? And I'll ask one of our funders, Tunji, to go first.
Thank you, Megan. I think critically what is shown us is that our health systems aren't as resilient as we thought. And this is right across the globe, and how much more in lower resource areas is really put resiliency, to a test. And clearly, if you look at that, it shows that there is the need for more collaboration, and really important collaborations around demand and supply to ensure that we are able to address these challenges, make our systems a lot more resilient, and reduce a lot of that inequality that already exists. I'm happy to hand over to Harrington to wrap up. Thank you.
Yes, we'd definitely like to have one of our local representatives have the last word. Hennington?
Thank you very much. Thank you very much for listening in. The number one issue is logistics. Intercountry imports and exports have been really challenging, and they still continue to challenge us on this part of the world. It's been so hard to timely source and make equipment available where they need to be. And this is a matter of time. It's a matter of life and death. So more has to be done to support local innovators and local manufacturing and for local solutions. A case in point that we have to look at that is really interesting. It's a good example of South Korea, how they really focused and invested in local industry and manufacturing, and that has really made a great difference. It's one way that we would advise to look at things. Over to you.
Thank you. I think absolutely critical. Unfortunately, we are near time, so I have to wrap up this very interesting discussion. First, let me thank our panelists and guests, and especially the hosts of our event, the Millennium Lives Collective and Equalize Health, for bringing us together. Thank you very much to the audience. We really value your input, and thank you also to all of those who couldn't be here today, but who did contribute content. If you could take a moment, you are about to get a link to a survey on what you thought of this event, and it's going to pop up in your browser once the event ends. Please let us know what you think and how you intend on following up after this event. And if you would be interested in collaborating in the Million Lives Collective in the future, a really important way to move forward with this conversation and other important issues about really enabling the global health ecosystem. More information about the MLC and some of our hosts can be found at the links here. Thank you, everybody. I really appreciate all your contributions and all the hard work that you've been doing. Thank you.
Thank you.
Thank you, Megan.
Thank you, everyone.